Namaste from India. Myself, Dr. Pratibha Mamgain. I have done MD and PhD in Ayurvedic medicine from Banaras Hindu University, and I have experience in internal medicine of Ayurveda, uh, almost 35 years. I am very happy to share this stage with all of you. So, what is Ayurveda? Literally meaning life science is the ancient Indian medical science, the only ancient independent scientific system of medicine. Origin can be traced back to Vedas, especially Rig Veda and Atharvaveda, but still all the parameters are applicable. It was the only main system of public health in India up to the middle of the 18th century, till the conventional medicine came in its existence. What is the advantages of Ayurveda when you have a conventional system of medicine? Why you should follow Ayurveda? It is easily available, it is less expensive, derived from nature, user-friendly, and is less toxic. And Ayurveda is capable of treating most of the diseases, excluding acute infections and the diseases which require surgical intervention. Ayurveda is holistic. Ayurveda helps people for preservation of health also with the treatment of diseases. Understanding each individual at personal level, because everybody is different. So Ayurveda understands each individual on personal level. Management of diseases includes diet, lifestyle, also along with the medicines. It cares about a balanced relationship of individuals with the society and universe, because whatever we give to the society or to the universe, same thing comes back. All the actions have its reactions. It describes how one can make life advantageous for self and for others. So how we can understand health? According to Ayurveda, universe as well as human body are made of 5 basic elements, collectively called Panch Mahabhutas: Akash, Vayu, Agni, Jal and Prithvi. That means ether, air, fire, water and Prithvi. These make all the human beings as well as everything in the universe. Atma or the soul is the 6th mandatory element with these 5 basic elements. So what are the basic units of the body according to the Ayurveda? Ayurveda says Dosh Dhatu Malmoolam Hi Shariram. So 3 things make base of the body and are important for health. These are 3 doshas or 3 fundamental energy forces: Vat, Pitta and Kapha, 7 dhatus and 3 malas or the waste products. So what are the doshas? Doshas are important part of Ayurveda, forms basis of maintenance of health. In normal state they sustains body. Any disturbance in their equilibrium leads to disease. So these are very important for the health. These 3 doshas are made of 5 basic elements. Vat has dominance of air and ether, Pitta has dominance of fire and water, and Kapha has dominance of earth and water. What are the malas? Malas are also very important, which are waste products of our body. These includes material such as stool, urine and sweat, constantly eliminated from body in a natural way and helps in maintaining health. If malas accumulate inside the body, then these create disturbance in the bioenergy and in turn the illnesses. So malas react correspondingly to the hypo and hyperactivity of 3 bioenergies and 7 body tissues. Dhatus or the 7 body tissues are Ras, Rakt, Mans, Med, Asthi, Majja and Shukra. So these dhatus or the body tissues, these are also very important, and they do nutrition, oxygen exchange, movement, lubrication, support, filling and reproduction. Other things which are important for the health are srotas or all kind of micro and macro channels and agni which is of 13 types. Mental qualities are also very important. So when we are coming to the health, we say sam doshah samagnishcha sam dhatu malkriyah prasannatmendriya manah swasth ityabhidhiyate. So when we have balance of all the three doshas, when the fires, all the 13 type of fire is balanced, when the body tissues are also functioning properly, and when the malas or the waste products are eliminating in right way, also when we have a happy mind and all the sensory organs are functioning properly, then a person is known as healthy person. So in Ayurveda it is very important that you should have mind also happy with the body health. So body and mind both are very, very important. So also Ayurveda has very special system of diagnosis. We have many types of examination. Darshan, Sparshan, Prashne means we inspect, we touch, and then we ask question. But also there is a Dash with Rogi Pariksha where we examine tenfold examination is done. Divisions of Ayurveda are, we have 8 major disciplines: Kaya Chikitsa or internal medicine, Manas Rog or psychiatry, Shalya Chikitsa or surgery, Shalakya or the diseases of eye, ear, nose and throat, Kaumar Bhritya or the pediatrics, and that also includes Stri Rog or the gynecology or obstetrics, Agar Tantra or toxicology, Jara or the geriatrics. And we also give various types of Rasayan Chikitsa or rejuvenative medicine in the geriatrics, and Vajikaran Chikitsa or the aphrodisiacs. Raw material for the Ayurveda we procure from the nature. We have more than 600 medicinal plants, 52 minerals and 50 animal products which we commonly use in our medicine.
Namaste, greetings from India. This is Dr. R.K. Mamgain, formerly professor in Himalayan Institute Hospital, Department of Ayurvedic Medicine, and presently working as consultant at Mamgain's Ayurvedic Clinic and Sattva Yoga Retreat. As Dr. Pratibha Mamgain have described elaborately about the concept of health and well-being in Ayurveda, Ayurveda is a science of life and giving more emphasis on the prevention of disease. It is better not to get sick. So the major preventive approaches for the maintenance of health and for improving the quality of life, we need to follow the daily regimens, Dincharya, which is described in Ayurveda for a healthy routine. Along with daily regimens, certainly there are also other regimens according to the season, which we call Ritucharya, the seasonal regimens, which is beneficial to keep ourselves in a good state of health, particularly at that season. Along with the daily regimens and the seasonal routines, the behavioral and ethical considerations, which is called in Ayurveda Sadavrit, have to be followed by all of us to keep ourselves happy and healthy. As far as the therapeutic modalities of Ayurveda are concerned, there is a very wide and very elaborative description of the different modes of the treatment, and for that we need to understand first the prakriti, the constitution, the temperament of the person, which is helpful in treating the patient as well as in making the diagnosis and also the prognosis. As far as the therapeutic streams are concerned, there are mainly 3 streams, which is called Daiva Vyapasraya Chikitsa, you can say the spiritual measures which we can take to improve the health of the patient, and the Yukti Vipassana Chikitsa is basically the rational therapy and the pharmacological approach, the therapies to treat the disease. Along with that, Sattva Vajaya, the non-pharmacological psychotherapies are also very important. So we need to work out on all the three, the spiritual measures, the pharmacological measures, as well as the psychological measures, and so we can treat the person in a very comprehensive way. An ideal treatment is not only curing the disease, because certainly we need to cure the disease, but along with that, there should not be any adverse effects or toxic effects of the medicine. So safety is also a very important thing, and which is taken care very nicely in Ayurveda. So if we talk about the treatment modalities, the first and foremost, the important thing is avoidance of the causative factors or the precipitating factors, what we call in Ayurveda nidana. So simply, sometimes we say that what is the treatment? Nidanam parivarjanam, means you should avoid the causative factors. And then certainly after that, we have a very particular treatment which is described by the name of Sansodhana, which means biopurification, which is a cleansing treatment, and you can say the detox. The another one is the palliative remedies by using the diet, the herbal preparations to make the doshas back into the balance is called sansamana. And then along with this, definitely we need to follow the health promoting regimens by means of healthy diet and lifestyle. So you can say the pathya, a particular kind of food which is helpful in that particular disease for that particular person, and along with the lifestyle. So these are the things which we are basically using for the treatment of the disease. So if you see in detail, then we can say the dincharya, the daily routine is helpful in that, the ratri charya, the night routine, the ritucharya, the seasonal routines according to the various seasons. Then sadavritta means your personal and social hygiene is also very important. Along with that, your nutrition and dietetics play an important role in the treatment of the diseases. And along with this, also the other important things in Ayurveda, they have described suppressible and non-suppressible urges. Some of the urges we need to control, and some of the urges we need to follow. If there is a call for the nature, you want to go to the toilet, you want to go for the urination, and you are feeling for the sneezing, we should not stop it. So we also need to consider all these things. Then another important thing which is basically very important in the treatment modalities is Sansodhana, which is very popular by the name of the Panchakarma, which basically means 5 procedures. So these are the very important tools for the treatment in Ayurveda. When we are prescribing the medicine, how you are taking the medicine, what sort of carrier or vehicle you are using to take the medicine, either water, honey, ghee or jaggery, milk or buttermilk, or are you taking with the herbal decoctions, this also play an important role in the effect, in the good therapeutic effect of the medicine. So we need to choose particular therapies or what kind of treatment for a particular patient. That depends upon the examination of the patient after the clinical examination and understanding the disease, its status and its stages. We can plan that what sort of treatment can be beneficial for this particular patient. Panchkarma is a very unique approach which is applicable both for preventive and curative treatment as well as for the promotion of health. So these therapies are advocated in both the situations. If the person is healthy, you can improve the health, you can use these therapies to promote the health, as well as if there is any kind of imbalance, for balancing of dosas, you can use the 5 types of bio-cleansing therapies. So mainly these are 5, and first one is called therapeutic induction of the vomiting, what we call in Ayurveda Vamana. The second one is therapeutic induction of the purgation, what we call Virechana. And the third is called Vasti, which is a kind of enema. And we have 2 kinds of enema. One is enema with more quantity of the oil, we call it Anuvasan Vasti. And the another is with more quantity of decoction, which is called Niruha Vasti. So Vamana, the vomiting therapy, is used for controlling the kapha or the diseases which is because of the imbalance of kapha. Virechana is used especially for those people who have imbalance of pitta or having pitta related disorders. If somebody is suffering from imbalance of vata and vata related disorders, then the vasti or the enema, either the decoction enema or the oil enema, is used to control the vata. So classically these therapies are practiced, but there is a particular schedule to follow these therapies. So we directly do not go for these therapies. We need to prepare the patient by means of some preparatory procedures. And in Ayurveda we call it Purva Karma, and they are mainly the Snehana, means internal and external volition of the body by means of medicated oils. And the second one is called Swedana, the sudation therapy, and in which we are trying to increase the sweating. Along with that, before we also give patients some Deepana, some medicines to improve the digestion. So these are called pre-procedures by means of which we are preparing the body for the actual cleansing, and that's why we call them pre-procedures or Purva Karma. The Pradhan Karma, as I already told, that vomiting therapy, the purgation therapy, and the different kind of enema, they are basically the principal measures to control the Vata, Pitta and Kapha. Along with that, the fifth one is also called Nasya Karma, means nasal therapies. We also put certain oil drops into the nostrils, and if somebody is suffering from any disorders related to the head region above the clavicle, then these kind of diseases can be cured by the nasal therapies. So these are the 5 main procedures. After finishing these 5 main procedures, we need to take care of the person by following some post procedures, and which we call a restorative regimen or Sansarjan Karma. Along with these, in Ayurveda, there are several other allied Panchkarma procedures also, like simply have a different kind of Abhyanga. Then there is called Sarvangadhara or Pijinchela, in which we are basically using lot of oil for the treatment. Sirodhara is basically pouring of the oil over the forehead. Nadi Shvedana, if you want to do a sudation therapy of a particular part, so you can do it locally, and we call it Nadi Sweda. Patra Pinda Sweda, that is, we are making the boluses of some herbal preparations, and then by means of that we are also inducing sweating. Kativasti, if you have somebody have pain and some spinal cord problems, any backache and all that, then in the back we use different kinds of medicated oil and put them on the back in making a special ring made by the floor, and then we put some hot oil into that and we keep that for 15 minutes, 20 minutes, and the patient get very good relief. So there are so many other treatment which are also used along the main Panchkarma procedures. All the procedures are very skillfully used under the supervision of the Ayurvedic consultant and by the very trained therapist. The Panchkarma is very much helpful in removing all the toxins from the body and works at the microcellular level and remove the toxins from there, and it is believed that it can eradicate the disease from its root. So Sanshodhana or the purification treatment is supposed to be more superior than the Sansamana or pacificatory treatment. In Sansamana treatment or pacificatory treatment, we are using the diet, the lifestyle, and the use of some herbal preparations to pacify the doshas. To pacify the doshas, and after the pacification of the doshas, they can come back to the normalcy and will not disturb the other doshas. But sometimes what happens, if favorable conditions for the disease appears again, there are chances of the recurrence, and that is the reason that the panchakarma or the bio purification procedures are supposed to be more superior than the sansamana therapy. So these are the commonest modalities of treatment which we are using in Ayurveda. Ayurveda is very particular, very comprehensive, very holistic, very naturalistic, and based on the principles which is perennial. They are always you can see the concept of the five basic elements. We are all taking care of consideration of all these elements in the treatment. The food whatever we are using is also made up of the five basic elements, and whatever the diet and lifestyle we are using, that according to the constitution of the person. So we are taking care of every aspect of the disease as well as the person who is suffering from the disease. So that is the basic difference. Like in the Western medicine, the treatment is more targeted to the disease, but here in Ayurveda we have equally give emphasis to the disease as well as the person who is suffering from the disease, and everybody has a different constitution. So it may be possible that if some people together suffering from the same disease, but their treatment may vary because their constitution is different, their prognosis may vary because their constitution is different. So that's why we consider all the dimensions of the life. Like life according to Ayurveda is combination of the body, senses, mind and soul. So Ayurveda consider all the dimensions of the life, and whenever we are taking. So that's why, as I said, that we have a spiritual measures as well as we have a pharmacological measures, and along with that we have also sattva, the psychological therapies to treat the person. So this is the beauty of Ayurveda, and that's why, especially if we talk about the chronic diseases and lifestyle disorders, then Ayurveda is the giving you more options to treat such diseases in a very natural way. As far as the acute infections are concerned and acute crises or acute diseases, then certainly the Western medicine is best for those kind of problems. So if you want to keep yourself in a good health, if you want to live a long life, the concept of following the daily regimens, the seasonal routines, rejuvenations, use of rasayana, the herbal preparations which can boost up your immunity, which can boost up your vigor and vitality, can certainly improve your health, and there are least chances that you will get sick. So wish you all a very good health and happiness, and follow the principles of yoga and Ayurveda to keep yourself in a good state of health. Thank you.